Telehealth is a system that allows us to monitor a patient remotely. The patient sends through on a daily basis information on their pulse, their oxygen levels, their blood pressure, and we can also monitor their weight. And they also ask a series of questions that comes back to us in our office and allows us to see how that patient is doing that day.
What it means for patients that if they can stay at home, that they remain with their family, with their friends, with their neighbours, with their support mechanisms in place, they can recover more quickly and they are happier there.
But the best thing about it is if things are not right, I do it in the morning anyway and I send it through to Chris Finnegan and she'll check it and she'll either ring me or contact my GP, one or the other, and you know that's the best thing about it, there's somebody there on hand all the time.
So that must be very reassuring.
Oh God, yeah, it really is reassuring. I wouldn't be without it now.
Information is transmitted down the telephone line, includes oxygen levels, their pulse, their blood pressure and their weight. We also ask them a series of questions that they answer yes or no, and that comes back to us on a computer. We can read it on our computer screen and it will give us some information about how that person is that day.
Or you can tell if you're not right, but if you check it and you can see then, and I can either, if it is not right, I can either ring Chris or ring my doctor and they come more or less straight away. So, you know, it really is a benefit, and if I want to go out somewhere I'll check it before I go and then I know I'm alright to get out.
And I think the most important message that I'd like to convey is that patients often appreciate that they are getting individualised care and that they know that that we've gone over things in the past and that we've got to a place where I think that they are able to look after themselves better. So I think that they appreciate the individuality of the relationship between nurse and patient.
The main benefits of telehealth are to the patient in promoting self-management. It helps them to understand what's happening with their body and help them to recognise symptoms of deterioration much sooner. It also helps to reduce hospital admissions. Again, these patients are not becoming as ill and we can look after them at home. There's also benefits generally to their quality of life. They're much healthier and far more confident in themselves and able to do the things that they would like to do.
Oh, they're the best thing that ever happened. They really are. You know, because it puts you completely, you know, at rest, thinking, you know, well, all I've got to do is check with that and you know, I can go out or I can do what I want to do.